Infectious disease experts say that a zero target for the community cases is not feasible at this point. Do we need to change that target? And also, why are we still seeing so many people out in the community while infectious? Do they not understand what that means and what being infectious in the community actually is?
Firstly, the New South Wales government relies on the best health advice we have, and I believe we have the best experts in Australia and arguably around the world working with us. So we will rely on their health advice as to when it's safe to ease restrictions, and we're looking forward to considering those opportunities early next week when we get some more solid data on the impact of the harsher restrictions we put in on Friday. So that is the first issue. The second issue is this is a cruel disease. You might be doing the right thing 24/7 but unintentionally get the disease from someone else, or unintentionally be a carrier and not know it. That is the cruelty of this disease. You might be doing everything right. That's why we had to take those difficult decisions about limiting interaction, especially at workplaces, because what workplaces do are bring in people from different suburbs and different areas. So what we need to stop is having this disease creep into different parts of Greater Sydney and, of course, in the regions. This is a cruel disease, and that's why we've had to be extra, extra tough in the way that we deal with it. But if we stick to the course, if we follow the rules we have in place, if we reduce our mobility and make sure, as hard as it is, the harder we work now, the less time we'll have to stay with the current restrictions in place.
But you talked about green shoots.
The University of Melbourne modelling is putting us not coming out of this until September at the earliest. Firstly, they've run this, they say, 10,000 times in all of the different scenarios, and that's as good as it's going to get for us. Do you agree with that modelling, and do you have your own modelling, and what does it say?
Look, can I say that we see versions of lots of different modelling. Remember the modelling we were presented with 18 months ago about the number of cases and deaths that would happen in Australia, which didn't materialise. So modelling has a role and a purpose. But what is the most effective tool for us to measure what the future looks like is the result of our own activity. The modelling can't predict how many people are going to stay in their homes and not be mobile. The modelling is just an indicator for what could happen, and different modelling gives you different results. What we need to do and what we need to rely on is our own actions, because that is what will determine the outcome. We've seen lots of modelling before which hasn't happened, which hasn't come to fruition. Modelling is an important tool, an important guide, and for every model there'll be a different and opposite model.